Hey, what's up? It's Joel Evan. I'm here with Dr. Jennings in Alameda, California. He's going to show you kind of like what kind of a typical appointment would be like when he's looking at people's jaws, and here's the mouthpieces I have, and he's going to kind of walk you through it.
Great. Let me have you put in your lower one first there. This is just clip right onto the teeth.
This is not your normal mouthpiece, folks. Look at this.
And your upper. And those little plastic blocks just miss each other, so it stimulates the jaw to bite forward. And then the way we check them, we have silicone, epoxy silicone that sets up in about 20 seconds. So we'll squirt this over the top of all of his teeth. Most dentists use carbon paper for checking stuff like this, but this is far more precise. Bite on that for me, Close. Good. And that'll sit up there pretty shortly, and then we take this material out and hold it up to the light, and the imprint will show us precisely how the teeth are coming together and allows us to fine-tune the to get them real even. Carbon paper shows you where you hit, but this shows you three-dimensionally how you hit. It'll give you a thickness. It's a little bit like a pressure gauge. If you're putting an engine together, it gives you a thickness to it. It gives you more precise than knowing just where it hit. And it's getting close there. Yeah, this blue goop is an essential part of what we do. We go through lots and lots of it every day. Good job. There we go. And then we can hold that up to the light, and it shows where you're hitting and how hard, and this is showing very equal amounts of light coming through on both sides, both on the top appliance and the ramps where the two appliances meet. And so this allows us to get things real precise. It shows us that on his last tooth there's no contact, which will be allowing his back tooth to erupt up taller, and ultimately then he won't need these plastic blocks. He'll get back, his back teeth will get tall enough that we can let him back down on his real teeth. Take out your upper appliance. In the event that there was something off on these, we would put it on the bite like this, and then we would be able to drill right through the blue goop, right exactly where the defect is, with our little drills to correct it and fine tune it.
Very cool. When you, and I know, you know, when you look at my teeth now, you do it so quick. You'll look at it and go kind of, you can like, you have so much mastery in this that you're like able to like look at millimeters and like just by like, you know, how long did that take? Because I mean, I'm sure in the beginning you have to like really be, but now I feel like you just look at it and you're like, oh yeah, it's like a couple of millimeters. I'll hear you counting, you know, in your head, like 1, 2, just by look at your eye. You have an eye for it, you know.
So put that in. We'll look at yours on your real teeth. So bite, close, smile. So these are flush. So the front to back looks right. And then we got to visualize how these are going to come down. So this side through here is all collapsed in a little bit. We got to push it out. Upper teeth should be a half a tooth out over the bottom teeth, more like this side is. This side's still got to go out a little bit too. Still not quite a half a tooth. So teeth are like gears. Upper teeth hang a half a tooth outside of your bottom teeth. So your outside peak hits the middle and the inside peak hits the middle. And so it's a matter of moving those jaws wider to get to effectuate that. And so we'll eventually have everything coordinated right to left as they vertically develop. But the main defect in Joel's case is through this side. And the back molar we kicked out just kind of sticks out there by itself at this point, but we'll eventually move all the middle teeth too. And as we widen the lower jaw, there'll be room enough to get these forward and that all tucked into a nice fair arc on him. So these appliances are much better at widening jaws than braces are. They grab lower on the tooth, so when you move the teeth move bodily. The higher up you grab a tooth, the more it's going to tip without bodily moving. So these were designed to originally make jaws grow wider.
Yeah, you're creating that space naturally so the teeth can move in where they need to. Whereas modern day braces, they're just making them look pretty. They're making them look, you know, they're making them look pretty.
They're not People that do braces are only looking at you skeletally and not functionally.
Yes.
So where we put that lower jaw is where the jaw hinges on a natural arc. We're trying to find that natural arc of up and closing. That is, when you're trying to figure out where a jaw should be, it's not best to look at where you close to, which is where orthodontists start from. They put your teeth together and diagnose you. We look at where you open and diagnose you. That is, from where you go in space as you open, it dictates where you're going to be when you close. Right, and so it's that fair arc that we're looking for that's not used and incorporated into traditional orthodontics. You can't get back teeth taller with braces. You have to have plastic in between the teeth to support the jaw. Make room for those teeth to grow. If teeth are always touching, they won't grow. So you have to put plastic in there to support some of the teeth while you let the other ones grow.
Yeah, hence the retainers. Hence the way that.
In orthodontics, they put you in braces and they're treating all teeth simultaneously. Here we're doing segmental orthodontics. We're treating one segment at a time. Right, we treat the back and the front, and then we eventually go back in and treat the middle.
Love it. Boom. Amazing.